Hello, my name's Alex Page and welcome to Page Care's Let's Talk About Care. The following video is on first aid kits. Now this isn't a tutorial on how to use first aid kits. This is just explaining how we customise our first aid kit for our challenges that we might face on a day-to-day basis. If you're working in care and looking after somebody, I would really recommend doing some sort of course. There's plenty of companies out there that do a range of courses, from a day course to a full week course, depending on your needs. And in the description below there'll be a link to a couple of courses and information on what kind of first aid courses will suit your needs. So the bag that I'll be demonstrating in a second is great because it's a camera bag and it kind of sits on your shoulders, and it's got two main pockets, which means that if you're in a location where you haven't exactly got the most hygienic surrounding, you don't have to put the first aid bag on the floor. You keep it on your person and out of any dirt or any water that may be around you. And because I've got the two pocket system, the first pocket you open up, you clean your hands, and then when you're doing the second pocket you're already hygienic, so you're keeping all your first aid equipment all nice and clean. So the small pocket, when you first open it, has got a hand wash. So this will kill 99% of all bacteria. Keep your hands nice and clean if you're dealing with the first aid situation. We also have gloves, always useful. So the second part of the bag has tissues. You always need tissues, and different sorts of plasters. Now I've got 3 different plasters, and these ones are waterproof. We've got plasters here that are on a roll, so it depends on what kind of size you need. Makes it nice and easy, more customisable. We've also, instead, because some people they've got weaker skins, they can't have plasters sticking to their skin, so what we have is Menlin pads. So they're non-adhesive. You stick on the area, you go in your pack, and you get your bandage. Then you wrap around the bandage, and these are self-sticking, so they stick to themselves, so you don't have to tape it on. You just nice and quickly stop any bleeding, stop anything getting into the wound. Right. We also have 2 lots of bandages, one spare one. We have a bandage, triangular bandage, so if anyone has any arm injury we can then help with that. We also have paracetamol. They have to be very careful when giving people medication, so only if you know they can take it. Now this is the one thing, before you put any plasters on, my hair's getting in the way, always use antiseptic wipes. That just cleans the area up, make sure you're not trapping in any bacteria or any dirt in there. Right, and the other thing is, people can get stuff trapped in their eyes quite often. Here we have a nice big eye wash box, right? So it's got the tube and the actual cup to sit on the eye, just in case, and eye drops in case you've just got sore eyes. Right, now if you're out somewhere and you fall over, you've cut yourself and there's dirt in the wound, before you bandage it up you want to clean the dirt out. Any dirt is going to be a host for bacteria and infections. So here we've got a saline solution. So basically it's just kind of clean water basically. You can just take it off and then pour it on to try and clean up the wound. Obviously it's a really big wound, you don't want to be pouring it on too much, but just to try and clean it off a little bit. But if it is a very big wound, obviously you're not going to be dealing with it. You're going to be calling 999 and letting them deal with it. On the other side, so one of the people we look after has seizures, so sometimes that means that he can be sick. So or just froth in the mouth or something, or the liquids coming out of the mouth. We have wet wipes so we can clean up, make him feel better. You don't want to be lying there with sick kind of dripping off your mouth. This is not very nice for him. We can always wipe his face, make him feel a bit cooler. This is the second bag. We've also got a high-vis vest, which at night will save your life. You don't be run over by a car when you're bending over looking after somebody. We've also got a notebook. Now this is key, because if you are with somebody, may have an accident, you probably want to write down some details. not only for your safety, but you want to be giving the paramedics as much detail as you could possibly write down. So let's say the paramedics are on the way and they're going to be 5 minutes. You can write down as much as your knowledge all about this person, any medical history, if they're epileptic, if they're diabetic, all that stuff. So when the paramedics come, they don't have to worry about that so much because it's all written down for them. They can concentrate on looking after the person. So, if you have any questions, feel free to ask in the comments below. In the link, in the description below, there's a link to our Facebook, our Twitter, our new Patreon and our YouTube accounts. So we look forward to hearing from you. Thank you.